I'm Monica Robbins with your top 3 health headlines. More than a third of Americans say they've never been screened for cancer or they don't know which tests they need. A new survey from mesothelioma.com finds many younger Americans aren't keeping up with cancer screenings. That jumps to more than half of Gen Z adults. Many younger people say they feel unprepared to spot early warning signs, even as diagnoses rise among Americans under 50. 1 in 4 adults under 40 don't realize the risk of asbestos, that it still exists today through home renovations, aging buildings, and certain jobs. And while it's critical to get those scans, science relating to genetic changes is advancing significantly, which could make them much easier.
Our ability to find things earlier with DNA testing really is likely to revolutionize what we can do, both on finding cancers earlier as a screening sort of way to look. And even if people have had cancers, there's a lot of work being done looking at tumor DNA that might show up in a patient before imaging shows evidence of a recurrence. And so this is really going to be something that changes how we think about cancer, how we find it, how we follow it.
Talk to your health provider about cancer screenings. Preventative screenings remain fully covered by most health insurance and Medicare. Also, the survey found more than a quarter of Americans say social media or artificial intelligence tools push them to consider a screening. Testosterone therapy may soon come up with updated warning labels. The U.S. Department of Health and Human Services says the latest evidence no longer supports older warnings around heart risks, prostate cancer, and enlarged prostate. The agency is requesting that the labels be changed to reflect this. The change could make the treatment easier to access, and experts say testosterone treatment is still a medical therapy, not a wellness shortcut, and it should be given under the guidance of a physician. Have you seen the summer headlines about a brain-eating amoeba? It's extremely rare, but worth understanding. Cleveland Clinic says the microscopic amoeba lives in warm, freshwater lakes and rivers and in poorly kept pools. If contaminated water enters the nose and reaches the brain, it can potentially cause an often deadly infection. A few simple steps help. Hold your nose if you're jumping into fresh water and keep your head above the surface in hot springs. Watch for fever, headache, nausea, or confusion after swimming and get care right away. I'm Monica Robbins, and that's your Daily Dose.